Okay, welcome everyone. I think it's 1 o'clock on my time here in Oshawa, so that's where we'll get started. So it's a pleasure to see you all. My name is Julia Finechko, and I'm the Associate Director for the Long-Term Care Best Practices here at RNAO. Just wanted to encourage you to turn on your cameras if you're able to do so, encouraging you to raise your hand and ask questions, or feel free to unmute your mic and ask any questions if you have any, or to utilize the chat. My colleagues here on the call will be gladly available to answer questions that you may have. And so welcome to the Best Practice Spotlight Organization Information Webinar for Tuesday, August the 19th. It's hard to believe that the summer is almost behind us. And I think some folks are wrapping up vacation and getting perhaps kids ready for school. I know I am. And so the pace is fast. But wanted to welcome you today. And I'm going to begin with the land acknowledgement. And so we recognize that our work and the work of our members takes place on traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of the RNAO is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, which is an agreement between the Iroquois Confederacy and the Ojibwe and Allied Nations to peaceably share and care for the resources around the Great Lakes. We also recognize that the participants of today's webinar are located on other traditional lands across Ontario. Today, this land is still the home to many First Nations, Inuit, and Métis people from across Turtle Island, and we are very grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking a part in the act of reconciliation, honoring the land and the Indigenous heritage, which dates back over 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. So welcome once again. It's a pleasure to see you all on our call this afternoon. There's quite a big turnout, and so thank you for taking the time out of your busy day. As I shared, my name is Julia Finechko. With me, I have Ms. Sue Sweeney, my colleague here, who's a program manager in the BPSO Long-Term Care Best Practices program, and also my colleague, Janet Chi, who wore the same blazer as she has in this photo, so I appreciate the connectivity there. So Janet is the Associate Director for the Implementation Science team here at RNAO. And so for today's session, I'm going to begin with a bit of an overview as to what RNAO is and what the BPSO programs are. I'm going to pass it over to my colleague here, Sue Sweeney, who's going to speak to scale and impact. And we have a few wonderful guest speakers that will share their own personal experiences and journeys of implementing best practice guidelines in their organizations. And then I'll provide a bit of an overview as to the BPSO program deliverables and what the requirements are. And then Janet's going to wrap up today's webinar with a look at what the eligibility requirements are, what the application process and timelines look like, and the three of us alongside our colleagues will be available to answer any questions that you may have. And so the Registered Nurses Association of Ontario, as you may be familiar with, is a professional association of registered nurses, nurse practitioners, and nursing students in Ontario, Canada. We're a strong and credible voice that leads the nursing profession. We influence and promote healthy public policy and clinical excellence. And health policy is actually a core pillar of our program and our association. And so what we're going to speak to today is the Best Practice Spotlight organization, which sits within the Best Practice Guideline program. And these are really signature movements of RNAO when it comes to knowledge mobilization and movement. And so the Best Practice Guideline was established here at RNAO in 1999 and really is a movement of these three pillars that we often refer to. And so it involves the development of guidelines that pull on evidence-based practices and is a comprehensive synthesis of what the best literature out there is. From there, we take these guidelines, we support their dissemination and implementation and sustainability across organizational settings. So if you're in the long-term care setting, academic, hospital, community space. And then we also have an evaluation component whereby we look at what does it mean to implement a best practice guideline? What does it mean in terms of impact to the patient, the resident, the community, the family, the system, and the sector more broadly? And so the best practice guideline was developed and funded by the Government of Ontario in 1999. And so it It includes the development, the dissemination, and the uptake and sustainability of these guidelines. And so we have over 52 best practice guidelines that we've published to date. They are available for free download on our website. And so I encourage you to have a look at these documents as they are available for you to consider and really determine their applicability in your own setting. And then we have a team of coaches that support all these sectors to help give legs to these best practice guidelines. And we do so utilizing implementation toolkits. And so we'll speak a little bit at a high level to two of these toolkits today. But again, this is about that vehicle or that mechanism to take what's in that research, what's in that evidence, and help give it traction in your organizational settings. And so the Best Practice Spotlight program is really about influence and uptake and sustainability of best practice guidelines across healthcare and academic organizations to advance practice excellence and optimize persons, organizations, and health systems outcome. So when you look at those three pillars I presented a few slides ago, this is very much about making influence and impact and looking at it from a micro to a macro systems perspective and level. What we're very excited about to share with you today is our inaugural cohort of the subspecialty of mental health and substance use BPSO program. And so I won't go into great detail about this initiative, but I will say that there is an upcoming webinar on September the 9th that organizations are encouraged to register and participate in. The event is on our events page, and my colleague Sabrina will include the link into the chat. But this is for organizations that are interested in joining a mental health and substance use subspecialty. And so the focus of their implementation would be two of our foundational guidelines, which include person and family-centered care and transitions in care, and then the implementation of either a mental health and substance use related best practice guideline or the Youth and Wellness Champions program. And so within this subspecialty, you'll receive all of the engagement and support that you would in any other program here at RNAO, but there is this intentional knowledge exchange that will happen and networking and connection of organizations within this program. So here again, there's a QR code if you wish to read a little bit more about this Youth Wellness Champions curriculum and for your consideration for joining in this cohort this time. And so why become a BPSO? So we're in Ontario. We have representation from academic organizations, long-term care is here, hospital, community. But if you can imagine, there's over 1,500 BPSOs around the world. And so here's a beautiful map, and you'll see the spread of these organizations and this program from North America to Africa to Central America and so forth. And so really when you join to become a BPSO, so you're joining in the social movement across the world. So becoming a BPSO is really about a formal agreement and engagement and partnership with RNAO to take 3 guidelines and implement them with these deliverables. And so in terms of deliverables, we speak to the BPSO infrastructure, so supporting your organization to be successful from a governance and a project management perspective, systemic best practice guideline implementation. So again, taking those guidelines and looking at conducting gap analysis and taking the recommendations and giving them footing in your organization, looking at the capacity development and exchange of information within your organizations alongside this larger community. Monitoring, evaluation, and research. So again, looking at what has been the outcomes of implementing best practice guidelines, the impact to your patients, to your residents, to your professors, nursing students, depending on your sector. The reach is quite large. And then dissemination with the intention of sharing your experiences with others. And so we'll spend a little bit more time going into each of these deliverables in this afternoon, but I do want to actually turn it over to my colleague here, Sue Sweeney, who's going to focus on sharing the scale and impact of BPSOs by facilitating a panel discussion with a few representatives from different sectors. And so I'll pass it on to Ms. Sue, and I'll stop sharing my screen.
Thanks, Julia. Welcome, everyone, and I want to welcome our 3 panelists. Melissa Gregory, who's Nursing Programs Coordinator and BPSO lead at John Noble Long-Term Care Home. We have Sherry Cope, who's Vice President of Patient Care and Chief Nursing Executive from St. Francis Memorial Hospital. And we have James Robbins, who's a BPSO integration co-lead from Confederation College. So welcome to the three, and thank you for joining us. Some of them are on vacation, and they were kind enough to come out and assist us with this webinar. So Melissa, I'm going to start with you. What motivated your organization to join the BPSO movement?
So the John Noble Home has always prided itself on being leaders in long-term care. We strive to set the standard in long-term care by delivering quality care, unmatched service, innovative ideas. I think we all know that the most successful organizations are proactive, so they adapt to change before they're forced to. So when we learned of the opportunity to join the BPSO movement, it was a very obvious choice for us, and it was the right choice for us. So the legislation under long-term care, as I'm sure a lot of long-term care homes here know, it's very thorough with a wide range of complex regulations. But there are many BPGs offered by BPSO that can help strengthen all of those mandatory programs with those BPGs. So this was an opportunity for us to refine our policies and procedures and get them in line with best practice evidence and compliance, and to ensure that our residents consistently receive the highest standards of care.
Thanks so much, Melissa. And Sherry, why did your organization as a hospital want to join the BPSO movement?
For sure. So it was actually my predecessor who had done the RFP. And I have a bit of a funny story that it was my very first week on the job. And I was told that, hey, you're going to Toronto for a launch of BPSO. And I said, well, I better figure out what that is. So so what I did is I pulled out the RFP and I did a crash course in BPSO. And I took some of my nurses down to Toronto, and it was such an amazing day that we had at that launch. And what I can tell from being at St. Francis for just about a year and a half now is St. Francis is very committed to continuous quality improvement. I myself chair the Continuous Quality Improvement Committee and the Quality Risk and Safety Committee, and we really structure all of our strategy and all of our interventions around continuous quality improvement. And it's just such a natural association and collaboration with the RNAO for the past year and a half being involved in this. And I'm just so pleased to be able to be here and sort of sharing some of that experiences.
That's great. Thank you so much, Sherry. And James, as an academic BPSO, what motivated your college to apply and become a BPSO?
Well, I think a lot of this was my co-lead, Dr. Michael Scarcella, who sits on the RNAO board for Region 12 and has been very involved with RNAO for a really long time. And we had already been using about 3 or 4 of the BPGs in some of our courses, but not as much as we wanted to. We were just kind of using them as a resource, and maybe they would show up in one class in a semester, and that was about it. And so Michael kind of facilitated a lot of the stuff to bring us on board. And we've been working really hard to implement our 3 BPGs, plus the ones that we were already using, kind of beefing those up a little bit. And we're super excited to be the first Indigenous focused RPN BPSO. So, some of these are RPN students, and they're going into their program, and by the time they get out of their first semester, they are spouting RNAO, BPGs, BPSO. They're super excited about this whole movement, and we're basically looking at it as we're building a really, really solid foundation for them that instead of your traditional nursing education, go do some research, write some papers. We're giving them the tools. Like, here is a tool. Like, this is your jumping off point when you're dealing with a patient who has diabetes and they've got an ulcer. Okay, well, here's a guideline and here's all the steps of, and it might not be the be all end all and give us all the answers, but it's a starting point. And so our students are starting to, I've had students come up to me after class and like, oh, you were talking about this. Did you know there's a BPG that relates to that? So they're going on their own and looking through the lists of guidelines. So it's super exciting to take something like this and not just implement it in all the different areas that they're going to be practicing in, but like right in their education. Like, here it is, day one, September 3rd, they're in my class at 8:30 in the morning. And the first thing they're going to hear after I introduce myself is all about RNAO and BPSO.
That's great. Thanks, James, for that. So, Sherry, can you share with us what you think the greatest impact of being a BPSO has been to your organization, your hospital?
For sure. What I've experienced as being part of this collaboration in the past year and a half is really that collective identity piece. It's something BPSO can bring teams together, can bring organizations together. You all of a sudden have a very good common goal. Everyone's aware of it. We're all wearing our champion pins. We have our banners. We're speaking all of a sudden the same language. And I hear that throughout the hospital. And Catherine and Nicole know my theory is, and sort of my vision is that for our hospital being so small, BPSO, the entire hospital is part of our and it's a very multidisciplinary BPSO committee that we have. And so it's really that collective identity, that collective language, those common goals. And in my role, I've actually taken BPSO and woven it through our strategy. So it's really become a foundation of our strategy, even at the senior management team level. And so we're all focused on our continuous quality improvement journey with BPSO as a real foundation of that. So I really feel that that's how we've benefited in the last year and a half.
That's amazing, Sherry. Thank you. And James, how would you say it's affected, or what's been the greatest impact of BPSO within your organization?
I would say getting feedback from nurses at the hospital, how our students are teaching them about some of the BPSO stuff and even though some of like our sites in Thunder Bay are already BPSOs, they may not see it on a day-to-day basis from a student perspective where they're very tunnel visioned at that point and thinking about their patient. What do I have to do next? What do I have to do next? So it's really cool to hear that feedback coming back. The other thing is, our senior team at Confederation College, our nursing department for the practical nursing department, we only have 4 full-time faculty. So we're quite small. We have about 80 students or about 100 students every year throughout the school year coming into the program. But hearing our senior management team and seeing them attending some of the events that we've been doing, we had our college president attending our in-person champions training, and just knowing that it's just really cool that they know what that statement means, what BPSO is. And even though they may not have a complete understanding yet of what it all entails, it's out there. And but yeah, I'd say the biggest part is getting that feedback from nurses, preceptors, clinical instructors about how our students are sharing that information.
And you're also, James, you're also utilizing Indigenous ways of two-eyed seeing approach.
Yeah, that's been really, really neat. We've always, given, where we are located and our college has already done a lot of work with reconciliation and TRC and that. So meeting with I've met so many different people in the community and using so many different resources and everybody wants to help. Everybody wants to be a part of it. So that's really, really neat to be able to, we have our students,
most of the people in this meeting are new, but the people who've been on meetings with us, we've talked about this like crazy for a year. We have a patient teaching assignment, and we do an Indigenous focus on it. And so it's not just, okay, here's a case study and you have this a client that's Indigenous and they're going home. It's really digging deep and using not just RNAO and BPSO the guidelines. It's taking it to the next step, speaking to elders, speaking to members who identify as Indigenous, going to our Naganoan Council that's at the college to kind of figure out what is it that we have to do. So it's not just like discharging a patient from the hospital and they're going to go home. It's, you might be discharging a patient who's had a hip replacement, who needs 6 to 12 weeks of physiotherapy, and they're going into a northern community. There's no physiotherapist, there's no dietitian, there's not even a doctor on site. So it's really opening up the eyes to our students, and we're getting more and more new Canadians as our nursing students. So it's a little bit of they're coming into this not understanding a lot of that history. So it's really cool that we get to focus on, in nursing, we focus on that science base, like here's the why, here's the rationale, here's the evidence. And, a lot of that is in the BPGs, but then we also have to look at it from an individual perspective. And yes, we focus on Indigenous, but it's for every single person, that just because the research says it works here like this, we still have to, ease into it and work around it. And it's not black and white. So it's really ensuring that students are taking that evidence and then applying it to individuals to meet their specific needs, to meet that patient where they're at that moment.
That's great. Thanks, James. And Melissa, what's been the greatest impact of BPSO on your organization?
I think one of the greatest has been improved outcomes, right? So as we're collecting data, so we have completed 6 best practice guidelines in our home. And as we're collecting data on that, we are starting to see an overall meaningful and positive improvements on care. So these improvements are ensuring greater safety, well-being, and quality care for our residents. The other impact that we've seen is something post-COVID. So during COVID, our home really fell off the tracks with BPSO and BPG implementation, and that was due to isolation precautions and large staffing turnovers. So we kind of made 2025 the year of BPSO within our home, and we reintroduced the program to our staff because we have a whole, our staff now is not what we had before, all new staff. We reintroduced them to not only the program, but all of the BPGs that we've completed pre and post-COVID. And in doing so, we have witnessed a really positive shift in our staff, noticeable improvements in care, and meaningful growth with the team work among our staff. So they're kind of guided by this BPSO vision, and our team members are learning, they're growing, and they're sustaining change collectively as a team. And we see this in measurable improvements in care and how happy our residents are.
That's amazing. Thank you, Melissa. So for a final question to each of you, what tip would you give organizations who are contemplating being a BPSO? And I'll start with you, James. What do you think?
Use your tools. Use your coaches. We have had the most amazing experiences with everybody that's crossed our paths with RNAO. And it can seem a little overwhelming when you go into the toolkit, but start small. I feel like I use this phrase a lot, but I was always told, you can only eat an elephant one bite at a time. And this is a big job, and we love it. We absolutely love the change, the whole project, the changes that we're seeing. But use your coaches. There's no such thing as a stupid question. The toolkit it's vast, but I feel like a lot of things that you're going to have questions about, you're going to find something in there. And even though every time I go in there, I find something new. I'm like, oh, where was this a month ago when I needed it? And it's like, oh, okay, it's there. So it's get in there and dig and find the forms. And not every single form is going to apply to you. Not every single recommendation or best practice statement is going to apply to you or your organization or whatever project is that you're working on. It's not as intimidating as it feels like on day one. So have fun with it, because it's an amazing opportunity. We just absolutely love it. And I'm a little sad that our first year is over already. And that, we only have 2 years left of this process. So have fun with it. That's the most important thing, I think.
Thank you so much, Jamis. And as you know, after pre-designation, there's designation, so you never really leave us. So, Sherry, what would you say your biggest tip is?
Well, it's funny because I was just about to say, don't be afraid, just do it. I was overwhelmed that first week when I just started my new job, and I realized I would be the lead for this. But looking back, I am so happy that we are part of this process. It's fun. It's really fun. Just as Jamis said, don't boil the ocean, take small bites. Your coaches are there to keep you going, to give you support. The coaches are amazing. They're incredible. And everything is laid out so well, step by step. You know what you're doing, you know when you're to do things. And don't be shy to go to events in person. I love going to the events in person. I get so energized when I come back, and you get to meet your coaches in person, and you get to meet others some are much further along the journey than you are, and they can help you and give you ideas. And some of them are just like us today, and like we're in the first stages of it. But it's really, really important to go in person. I try to go whenever I can. That being said, there's also opportunities for grants. So take advantage of grants. We've had the public visibility grant. We have the open house grant. There can be some subsidies if you are attending these in-person events. So if you're from a smaller organization such as mine, where there's budgetary constraints, those things are really, really important. And take some of your team members, because they will keep talking about that. And that's, again, how we spread that awareness and that excitement. Just don't be afraid. Just take it step by step and just do it.
That's great. Thanks, Sherry. I appreciate that. And Melissa, what's your final tip?
Well, I consider myself relatively still a new BPSO lead. So I took over the lead in our home about 1.5 years ago. I would say that true leadership is never a solo act, right? It requires collaboration and support of your entire team. So gather the support of your senior leadership team. When your workers can see that your leadership team is together and united, it inspires confidence, it inspires change within the organization. It makes everyone realize that change is real and it is achievable. I would also say to have a co-lead to support you on your journey. They will help you share the leadership responsibilities so that you're not feeling overwhelmed or overloaded. You guys can make decisions together, you share perspectives, and you keep each other accountable and focused to meet your deadlines. Build champions, right? So gather champions from every department within your facility or agency. Your champion team is what's going to influence change. They're going to lead by example. They're going to speak with one voice. They're going to show others in the organization that transformation is possible and that it's worth pursuing. And they're going to help support both the implementation and the sustainability. And then one more that's a little bit different than what the other girls said: make time for BPSO. So our regular duties and responsibilities are overwhelming enough. So designate some time every week to focus on prioritizing your BPSO projects. Regularly scheduled time will prevent delays. It keeps your projects moving forward, and it builds habits for change. And like Jamis said, use your coach. They're there for a reason, right? They come with knowledge, they come with experience. They're going to help you navigate challenges that you have, help you implement change within your organization. They play a very key role in helping you network, and they're a bridge for you guys for new connections to connect you to other homes or other organizations that have already accomplished the BPG that you're maybe looking at implementing, right? And I'll just say from personal experience, I don't know what I would do without my coach. I probably abuse her a little bit. I love her. I'm always in contact with her. If I have a question, she's right there for me. So yeah, that's a great tip, is to use your coach.
That's great. Thanks. And Jameis, you wanted to add
Yeah,
something?
I just wanted to add one thing. Melissa said, use your senior management team, get them involved. Also use the people that are right beside you, your frontline workers. Identify their strengths, even if it's something that doesn't seem like, oh, yeah, they're really good at this, but like, how can we integrate that? Help them identify their strengths and collaborate with them and basically sell them the dream. Sell them the dream, and they'll be more invested and more excited about the whole project.
Thanks, Jameis. Well, thank you to all three of you. We will take questions at the end of the webinar. If you can stay, that would be great. But thank you so much for taking the time out of your day to be with us and sharing your experiences. And I'll hand it back to you, Julia.
Thank you so much, Sue. And thank you, Sherry, Melissa, Jameis, for sharing your experiences. I'm just going to turn back to the slide deck here. Oh, apologies for that. So I'm going to spend the next few slides just going over the BPSO deliverables for the contract period of 2026 to 2029. And so in terms of the deliverables, we speak to this in terms of sort of 5 pillars or 5 categories of deliverables. And so we'll go section by section, beginning with the item on the far left side, which is BPSO infrastructure. And so we have a few slides dedicated to each of these areas, as there are certain deliverables and requirements that organizations must meet as part of their contractual agreement. So when we speak of a BPSO infrastructure, what we're asking organizations to do is to establish and follow an infrastructure to essentially support coordination, communication, reporting, and accountability of the BPSO program. So we heard a little bit from, I think it was Melissa, to speak about the role and the importance of BPSO leads and co-leads. And so again, from our own experience, having overseen this project through several years and several iterations across hospital, long-term care, academic settings, these BPSO leads and co-leads really support the success of the program within your respective organizations. They provide oversight, they advocate for resources, they champion change, and really identify key agents. The next item under BPSO infrastructure is to establish BPSO implementation teams. And so these teams, oftentimes we find organizations identify teams per best practice guidelines. And so you might have a lead for falls, for example, as a best practice guideline, or transitions in care and services. And so those leads support the implementation of those best practice guidelines. They participate in the gap analysis process and really communicate changes to individuals across the organization. Establishing a BPSO steering committee is really about individuals that are perhaps in more formal roles within your organizations that can advocate and support resource allocation, that can really promote and position the BPSO program within your overall organizational infrastructure and governance and strategic plan and direction. Dedication of financial resources. So what we heard a little bit from our presenters today is, this idea of having dedicated time to do the BPSO work and not something that's added on to, your day-to-day operations, whether you're in the hospital setting or academic or long-term care or community. And so dedicated financial resources could be actual financial resources to support launches and events that take place, or it could include in-kind financial resources such as supporting leads and co-leads to participate in events and to develop development of materials and oversight of resources. And then ensuring safe storage of BPSO related records. And so this is very much about developing centralized storage of BPSO materials within your respective organizations. And so if you're a little bit like me, sometimes you like to house things on your desktops, but desktops remain with people. And our experience has been that if individuals shift roles or they leave the organization, sometimes the work that's been done within the BPSO is lost in those moments. And so having centralized storage ensures that everyone can access the materials, everyone has a sense of where we are in terms of the workflow and work plan. The next area is capacity development and knowledge exchange. And so one of the required deliverables under here is to engage in the following work in order to support that capacity development and knowledge exchange. And so I think we all recognize, BPSO is a program and it's a large project that requires intentional effort by design to support changes, but as well as sustainability. And so we know this can't be driven by one person. It can't sit on one person's shoulders. And so we want to build the capacity of your teams, and we want to build it across those sitting shoulder to shoulder with you, to those in formal leadership roles, to those that are frontline staff, for example. And so there's a few requirements in the contract that relate to what it means to develop the capacity and the information and exchange of knowledge across your organization. So the first is you would facilitate a launch. First of all, you would attend a formal launch with us at RNAO, one that takes place in April. Following that, you would have your own individual launches that take place within your organization. And a big part of that is to understand the deliverables, but also to get people excited about BPSO and to find that momentum and to identify those individuals that are interested in participating, that could lead different programs and initiatives and guidelines depending on their interest, as James had said, depending on their skill set, for example. It's really important to celebrate, collectively, but also to use that opportunity to identify who your champions are, who are those key leads that can help move the work forward. The other requirement here is champion development. And so there's an idea that, again, it can't be driven by one individual, and there's a critical mass that needs to be reached within your organizations to help best practice guidelines gain traction, make change, and create sustainability within your organization. And so I do have a slide coming up to that, but we do have a formal curriculum that we do deliver to your organizations. We can do so in person or online. And really, it's about building capacity of individuals across the organizations at different levels to understand, what does it mean when we talk about evidence-based care? What does it mean when we talk about best practice guidelines? How do we actually take these guidelines and give them footing in your organization? And then again, how do we evaluate and sustain those changes over time? Coaching is the next component. So again, this is your support and coaching of others. So understanding that you would be coming in as a cohort. And you'll see, again, from today's presentations, we did have several individuals representing different organizations and sectors, really coaching and supporting one another. And so as you build your own capacity and as you excel in different aspects of the BPSO program, you might be tapped on the shoulder to support another organization that equally needs some support or is newer to the program. Knowledge exchange activities and annual symposium and summit. So again, we do have monthly, quarterly knowledge exchanges that take place. Again, depending on what sector you're in, sometimes these meetings take place monthly, sometimes they take place quarterly. It's an opportunity to bring you all together along that BPSO journey to discuss the deliverables, to discuss your achieved milestones, to share also your key learnings and successes. And again, it's completed virtually, and so you're able to join in from the comfort of your organization. The other is the annual symposium and summit. So it's been notoriously known as the symposium. This year, it's known as the summit. But really, this is an opportunity to come together. And again, we heard the presenters this afternoon, there's value in coming in person, and there's value in having in-person conversations to generate energy, to generate momentum, and to leave you feeling inspired in terms of the Best Practice Spotlight Organization program. The next is the annual Clinical Best Practice Guideline Institute. So this also takes place annually. It's about a 2-day event that takes place following oftentimes the launch. In this, we speak about the role of champions. We speak about change initiatives and how to further the work that you're doing within your organizations by sharing some additional knowledge, additional tools, and resources that are available through RNAO, but also free of charge through other associations and collective partners that we work with. And the last is the Advanced Clinical Practice Fellowship. So again, we heard Sherry speak to this afternoon. So there's a lot of opportunity whereby there's additional funding and resources made available to you. So the Advanced Clinical Practice Fellowship is an example of just one. And this is $15,000 that organizations can receive. So you'd have to apply towards this program. You'd have to go into it with an idea as to how you want to take a guideline and champion its change within your organization. So there's a formal process to it, and it's really an agreement that you're going to have a registered nurse or nurse practitioner or an interprofessional team come together to move the best practice guidelines forward in the confines of 450 hours. So again, something to consider, something to think about, and your coaches that would work with you would help you to identify the deadlines for these submissions and the best way to approach such applications. So in terms of capacity development and knowledge exchange, so again, this is the Best Practice Champions Network. So we've prepared thousands of individuals within Ontario, within Canada, and internationally. As I shared, this is about having that critical mass of change agents within your organization to help support the change that you wish to make. And so this curriculum is available online as well. We have coaches going into your organization. So for the long-term care team, for example, going into long-term care homes, our coaches supporting the hospital, also going into hospital and all sectors, and really delivering this curriculum in about a 6-hour time frame, really engaging your frontline clinicians, whether it's housekeeping, maintenance, your CEOs. I've seen CEOs in some of these sessions, really helping them to, again, understand evidence-based practices, their role in championing change, and their role in sustaining that momentum going forward. So capacity development and knowledge exchange, again, here are just a few photos from events that took place recently. So we had our annual BPSO Knowledge Exchange Symposium, which took place in November, and then the RNAO 23rd Annual Clinical Best Practice Guideline, which just took place in May and June of this year. And we do have our summit that's coming up and also available for you to attend if you're interested. That's taking place in September. So the next required deliverable is this idea of systematic implementation of best practice guidelines. And so in terms of this work, the BPSO is agreeing to implement 3 best practice guidelines within the 3-year pre-designate period. And so the 2 guidelines that are mandatory is transitions in care and services and people-centered care. And so my colleague Janet had mentioned in the chat box, this guideline is going to be for release in September. But these are the 2 mandatory guidelines that all organizations must implement. The third is the clinical guideline of your choice. So you might be in an organization where falls is a concern. So that might be a guideline that you wish to pursue. We also spoke about the mental health program. So again, you might be interested in a guideline that focuses in that area, or the Youth and Wellness Champions program. And so by doing systematic implementation, we're asking, and we're going to work with you as coaches to really complete a gap analysis. So looking at the recommendations and the good practice statements in each of these guidelines, and to perform a gap analysis comparing what the research is saying we should be doing with the realities of how we're providing care and organizing care within our organizations. From there, we're going to develop an action plan and identify what are the interventions that's going to move the needle forward and help bridge that gap. And again, with that, doing comprehensive implementation. So for every gap or unmet area you've identified, you're thinking intentionally, well, how do I actually address this in practice? How do I ensure the right education is provided? How do I update my policies to reflect what is required and what is best practice as per the research? Again, we heard Jameis speak of the toolkit, and my colleague Catherine had included the link in the chat box. But these are really, we have a few toolkits that we use, but one of the greatest ones is the Leading Change Toolkit. And so we've come to learn over time that, you know, in order to make change effective, in order to make change sustainable, and to be intentional with it, you really have to utilize frameworks. And so these are the two frameworks that we at RNAO use. Again, if you think of 1,500 BPSOs, they've all looked at these frameworks and all looked at their integration and implementation in their organizational setting. And so the social movement action framework is about the people side of change. Again, recognizing that one person can't carry this work. And so how do we get a grouping of individuals that are excited about making the change happen, that identify and understand the need for the change and understand why it's important to to do this change in relation to, you know, much that's going on within the organizational setting. The other side, on the right-hand side, is really about that process part of change and implementation. And so where you see that knowledge creation in the middle, imagine our best practice guidelines in there. And so taking that best practice guideline and identifying, you know, what the problem is in your organization. So again, thinking of it in the context of falls, and then determining, again, what is the research saying versus our practice, identifying your local context and what makes sense within your organizational setting, identifying your interventions, implementing those interventions, and then monitoring, like, did what we do make a big difference for our patients, for our residents, for our families, and so forth. And so again, these are the two frameworks that that we work with, available in that Leading Change Toolkit. It's very comprehensive, and the QR code is there available if you wish to have a look. The next one relates to monitoring, evaluation, and research. So again, the BPSO commits to ongoing activities, including monitoring, evaluation, research, to ensure accountability and support that BPSO journey towards designation. And so we have a few activities that BPSO organizations participate in during that pre-designate phase, so that 3-year phase. So the first is reporting. So we do have a new hub report that organizations will be entering information into. So this is an online report that you're going to complete twice a year. It's strongly encouraged that you share the report within your organization. Alongside that report, you know, we at RNAO are going to receive it, we're going to review it and meet with you to discuss what are your key learnings, what are your areas of success, what were you challenged by, and also where can we grow as an association and what can we do to further support you as an organization within the best practice guidelines and the BPSO movement. The next is Enquire. So this really relates to looking at data and evaluation. So we do have a few items that we ask organizations to submit to. So uptake and sustainability indicators. So looking at the spread of those best practice guidelines in your organization and the BPSO movement, indicators related to human resources, and then guideline specific indicators. So if you think of this concept of falls, you know, did you have less falls at the end of the day? Did you appropriately screen everyone who was at risk for falls to have the correct screening tool completed? And so these are just some of the questions and the data that we would collect in that Enquire system. With that, you have reports that can be generated and that can be shared with your team members, with your board of directors even, and made publicly available for your families, patients, and so forth. The next is the RNAO site visit. So again, on that 3-year journey, this is part of the designation process. There will be a few individuals from RNAO that come and visit your organization. So if it's in long-term care, it'll be myself and Sue. If it's within the hospital sector, depending on your coach, it would be Janet as well as the associate director. Sabrina may be going to the substance organizations, mental health and substance use organizations as well. And again, it's with the intention of looking at what does BPSO look like within your organization? We've read your report, we've had meetings with you, but do we have a sense of BPSO? Is there, you know, that social movement, is that energy, that excitement across your organization evident and visible? And then other opportunities include program evaluation and research. The last one relates to dissemination. And so recognizing that this work is funded by the government of Ontario. And so is the roles and the coaching that we do for the organizations. And so there's a requirement that organizations participate and complete external dissemination. So 3 of these activities over the 3 years. So presenting at a conference, for example, at an RNAO event, developing and publishing an impact story. So for example, on our website, we also have evidence boosters that you can work with the Enquire team and your coach to develop. And then participating in an RNAO committee. So this could include the development of a new guideline. For example, maybe we're looking at feedback from organizations and participants. Again, that BPSO launch, so within your organization, generating that excitement, starting the spread of that BPSO energy across your organization in all levels. Submission of a manuscript, so this could be to a peer-reviewed or non-peer-reviewed journal. And again, our coaches are more than happy to help you on this journey of writing a manuscript and helping to identify where the best forum is. Web page creation and maintenance. So again, within your organizational structure, having a website that highlights your role within the BPSO program, and as somebody that is one of those 1,500 organizations internationally. And then social media engagement and public visibility. So public visibility within the organization, and then social media is really taking that public visibility and making it visible on social media. So recognizing that has a big reach in terms of national and international. So really acknowledging your role within the BPSO program, the positive experiences, the outcomes that you're seeing on the patient side, on the clinician side, on the family side, for example, or more broadly as an organization, and sharing that with others. And so I'm going to wrap up with this last slide here, which is this idea of collective identity. And so you'll see the coaches on the calls, myself, we have our BPSO pins. Mine's a little bit hidden by my hair. But again, this is about public visibility and really coming together as organizations as part of this program. And so with the BPSO program and the BPSO footprint, you have active participation. And here's a few photos of individuals across organizations joining in on that excitement, joining in on that energy, conversation with patients and residents, really taking kind of a grassroots approach in terms of engagement and that collective culture that comes from the BPSO movement. And so I'll pause here, and then I will pass it on to my colleague Janet, who will speak more about the requirements as well as the eligibility and next steps.
Thank you so much, Julia. And so, as Jameis and others had mentioned, it is a 3-year partnership. It goes by quickly, but you never actually leave RNAO. The 3-year partnership is just the beginning. That's the part where you are a pre-designate. We're working with you very closely to get you to graduation. And then after graduation, you become a designate. And then you will have contracts following. So it never really ends, your connection with RNAO. And I will tell you, the fun also never ends because there's always new and exciting things happening. And so as part of the requirements, you'll also have to provide funding for the BPSO program. And so that will be also included. The information about that is included in the RFP. But before we talk about the RFP, I want to talk to you about the fact is BPSO is a partnership. It's a partnership between RNAO and you as an organization. And as a partnership, we at RNAO have a lot of supports to encourage, to support you through your BPSO journey. And you've heard quite a few times about your BPSO coach. So the BPSO coach is one of our biggest assets of this program. Is someone who is dedicated to you, to guide you, to support you through the journey. You have a question, you ask them. You are not sure about what's happening or what's going on or what these events are, you ask them. And if we don't have the answer, We have literally 30 more coaches in home office and across the province that somebody will have the answer or can connect you to a BPSO that has had a similar experience. And that is the value of your BPSO coach. And we as coaches can come and visit you in person as well as provide virtual coaching. We also have an orientation for you. So as part of the BPSO program, we have an orientation where you would come to Toronto for 2 days. That is supported by RNAO, your travel and your accommodations, to learn about how do I start the BPSO program. So that is a great way to learn and meet other BPSOs who are starting the journey with you at the same time. Julia talked a lot about capacity building with champions and events and knowledge exchanges. And, this is the way to learn, not only from your coach, not only from the resources and the champions workshop, but from each other. And that is one of the biggest values of a lot of these events, is meeting other BPSOs and learning from them and them learning from you. We also have, of course, lots of support for monitoring and evaluation and data collection. And so you never have to worry about, oh my goodness, I don't know how to submit, or the system isn't quite working. How do I do the collection? Our coaches are here to support you, both your BPSO coach, and we have Enquire coaches as well. And of course, there are occasionally research opportunities. And if we see that there might be a match with you, it's a great opportunity to get involved and be part of that. And again, lots of dissemination opportunities. So we had 3 wonderful presentations here today, and the presentations from our guest speakers count as dissemination. And so these are ways that we as coaches find opportunities to help you meet all the deliverable. And it's free. You do not have to pay RNAO a single thing. We are funded by the Government of Ontario. So I'll quickly just go over the eligibility criteria. And I will say that every contract usually is slightly different from the last. We're always looking to improve our program. And so if you have an old RFP from previous years, I highly suggest you get the new one. We've just updated. Julia and all of us have reviewed this one at least 100 times, and it has all of the latest information related to BPSO and all the eligibility requirements. And specifically, you could go to page 15 and 16. And so I'll just speak a little bit, next slide, about the RFP itself. It is exclusive to BPSOs in Ontario. So this RFP specifically, and the requirements specifically in this RFP, are for Ontario organizations. Now, if you're an organization from outside of Ontario, a different province or a different country, there is a separate process for you to still become a BPSO, because we have over 1,500 BPSOs globally. But I will say that this specific RFP is for our Ontario BPSOs, and anyone outside of Ontario or international, you can reach out to me directly, and I can also set you up to become a BPSO outside. So the application process itself is an online application. And so on the online application, you will submit all your answers, upload all your documents, and that is why we require you to submit a letter of intent. This letter of intent is really a simple letter. It can be an email to say, my name is Janet Chi. I'm really interested in BPSO, and what we do is then we give you access to the online application. There are specific questions, and those are all outlined in the RFP. And so I really encourage, if you're interested in BPSO, send a letter of intent. It's not binding. And by getting that letter of intent, we will give you access to the system. I always encourage people to go in early, check out the questions, see what they're asking, so that you can be prepared to put together and formulate your responses. We have a pretty robust system for reviewing and scoring all of the applications in an equitable manner. So each proposal is reviewed by 4 to 5 reviewers, and we also have a scoring system. And at the end, after we have reviewed all the applications, we will then inform the applicants in writing about the status of your application. So either you will very likely be told you have been accepted, or you have been accepted and there might be some minor clarifications or revisions that we might need, and we'll give you some time to do that as well, or a decline. So either way, that information is provided to you in writing, and of course, a coach will reach out and connect with you about your application process. We've divided up how we do the evaluations based on this rubric. So when you're thinking about where to put your energies, I would say probably you want to put your energies in all the sections. But this is just one indication if you're looking at, what are the sections that reviews are really focusing on based on our criteria. Okay, so these are some really important dates. The first is letter of intent is due on October 6th. Once again, I said it's a very simple email, just stating your name and your organization that you're interested in applying for BPSO. I will tell you, if this date you bypass it, it's still okay. The key for this letter of intent due date is so that we can open the application for you. And it does help us to prepare for how many reviewers we need to organize based on how many applications that we're getting. And what will happen is as soon as we receive all the letters, we will open up the online application for you. Now, the full proposal deadline is due on November 24th. When you review the application, it's not too, we've actually, for one, reduced quite a few of the questions. So we have made it a bit easier for all of our organizations interested in BPSO. But I will say that some parts are pretty easy to fill out in terms of, your interest, your background, but some parts will take more time. And so you may want to spend a little bit more time. And in particular, the part that I would say most organizations need to really focus on is to get together the letters of support. And so BPSO, as you've heard from many of our speakers, is not a one-person project. It really involves the entire organization. And with that, a really big part of how we review the applications is to see who is supporting this BPSO applications. Do we have CEO support? Do we have interdisciplinary support? Do we have support from the nursing team and professional practice? And those letters take time. Do you have support from a patient ombudsman or from the resident or family councils? These are really big indicators to us whether the organization is ready. So I would say as soon as you know that you would like to pursue a proposal, you really need to start talking and to all the important individuals in the organization to start getting those letters of support ready. Once we receive all the applications, we'll review, and then we'll notify everybody in February. So if you have any questions, connect with us. We have a few different emails here depending on the program. If you email one of us and you're like, I'm not sure if I should be emailing Andrea or just email one of us and we will get you to the right person. No worries. Or you can email all 3 of them and they will make sure that you get routed to the right person as well. I also have a few updates. Very exciting. We have our BPSO Global Summit, and I do understand we're 2 minutes over. So if you have to leave, I completely understand. But all of you are invited to the BPSO Global Summit. And once upon a time, this used to be only limited to our BPSOs. We're also opening it up to anybody who is interested in becoming a BPSO. And it used to be called a symposium. This year is called the Global Summit because there's a huge international component with our international BPSOs joining us. I personally call it our BPSO extravaganza because it's 3 days of a BPSO. It's free to attend. Just go to the link below for registration. It's in Toronto, North York, and we would love to see you there. So register, bring your friends, and learn more about BPSO.